A dental implant is a titanium screw that actually goes into the jawbone, which replaces the root of a tooth. When you get the dental implant, we actually have something called an abutment, which simulates a tooth coming through the gum, and then you put a crown on top of that, and you have a permanent solution to a tooth that you lost. It doesn't come out. You clean it like a normal tooth. It lasts as long as a normal tooth, as long as you clean it and take care of it. The process of a dental implant is a patient comes to us. We have a variety of ways we can do the dental implant. Patients come to us because they like to have the implant placed the same day. When we take the tooth root out and nothing's replaced in that socket, you can actually have bone loss. So what I do, which cuts the treatment plan in half, is I actually place the dental implant the same day we take a single rooted tooth out. So what that does, instead of having a whole process of a year, it cuts your treatment plan down to 4 months. The benefit of an implant is when you do a bridge or a partial, you have to take the partial in and out of your mouth. It moves when you eat. You have little silver clasps that you can see when you smile or eat at a restaurant. The bridge, when you do that, is exactly what it describes, a bridge. So you go from one tooth to the next tooth with a fake tooth in the middle of it. But in order for that bridge to work, you actually have to grind down 2 perfectly good teeth. The way a dental implant works is we take the actual space, place the dental implant, and you end up with essentially what you had before the tooth was taken out. A root component, a tooth component, and a cap or a crown that goes over that. The care of dental implants is essentially just like a tooth. You brush and floss it just like normal. We like to actually have an implant for a tooth when we replace it with teeth that are existing. If you have existing teeth with spaces in between them, we can actually fill those spaces with dental implants, put the crown on top, and it looks like you haven't missing a tooth. Some patients come to me and they have dentures. They have no teeth, and they're tired of the denture when they chew, come up one side or cut into the gingiva, the gums, and it hurts when you try to chew something. Also with dentures, it limits what you can have to eat. You can't have apples, you can't chew hard steak. You're basically having to eat with soft foods or bland foods that you can very gently chew with the denture. Also, you have to use a lot of paste to keep your denture in place, which doesn't taste too good. And then if you get any food under the denture, you have to start the process of seating that denture all over again. When patients come to me with no teeth, we can do a procedure called an all-on-4. An all-on-4 technique is where someone comes to my office for initial consultation. There's a couple of things we look at to see if they're candidates. Number 1, we look at the soft tissue to make sure they have adequate soft tissue. Number 2, we look at the vertical and horizontal bone of the upper or lower jaw. The thing about an all-on-4 technique is most people who come to me who are missing teeth for a long time have bone loss. If you do bone grafting, it takes a longer procedure time to end up with finished dental implants. The thing about the all-on-4 technique is you generally have bone where we need to place the implants, more in the anterior portion of the upper jaw and anterior portion of the lower jaw. We used different angled type implants. We can only do 4 implants to put a prosthesis on top that actually screws to the dental implant. So when you walk into my office and we do what we call an all-on-4 technique, you have dentures that can take in and out of your mouth. And they're rather large because they have to fit over your gums and under your tongue and stuff like that. But with an all-on-4 technique, when we finish the case, if you can imagine a denture that's been cut down to maybe the size of your pinky, that's about how big your teeth are, and they screw directly to the dental implants. So you walk in with a denture that moves around when you come in here. When you leave the office, you leave with that denture significantly cut down, all the extra plastic off of it, screwed to the dental implants, and they don't come out.